The state of Michigan left its most vulnerable population behind all through the pandemic, so says those who fight for the rights of the disabled.
They say from the outset, the state never tracked cases among people with disabilities, and they want answers. Our Grant Herms shows us why they feel so let down when they needed help the most.
Needless to say, I'm angry about it.
For Chuck Kupovitz and his 39-year-old daughter, Pamela, the pandemic has been nothing short of life or death. Pamela has a lung disorder, leaving her highly at risk for COVID. But as the state moved through the pandemic, Chuck says they left people like Pamela out, even after multiple attempts to reach state and federal leaders.
This isn't just about me and my child. That's the primary thing, I guess. I'd be lying if I said otherwise. But there's a lot of other disabled people that are being neglected by the state, as far as I'm concerned.
Studies done over the course of the pandemic showed those with a mobility or sensory disability are more at risk to catch or die from COVID-19. Those with autism are twice as likely, and those with Down syndrome are 10 times more at risk. Many disabilities also have compounding health and economic factors too, making their risk even higher. A recent figure from the UK shows 60% of that nation's deaths were among those with a disability. But despite those staggering numbers, those with disabilities are not listed on the state's COVID dashboard.
It's bad. It's really bad. It's worse than any other disparity that we're seeing in other communities.
Dessa Cosma is with Detroit Disability Power. Her organization has been calling on the state to release any data they might have on COVID and people with disabilities. She says she's been told the data is too complicated to collect, even though the state does it in other areas already.
Where's the information about people with disabilities? Why isn't that aggregated there so that we can use it to save people's lives? It needs to be transparent and it needs to be available for it to do any good.
We did reach out to MDHHS today, which said they found about 4,000 people with disabilities in the COVID-19 numbers dating back to August. They also said that they're putting together a mortality study to assess those numbers, but still none of that is on the state's dashboard. Grant Herms, Local 4.